For over a century, Johnson & Johnson was untouchable, the kind of name mothers whispered to newborns, the kind of label doctors trusted without question. Then a mineral destroyed it. Talc, a soft white powder sitting inside their baby powder for over 100 years. The question was simple. Did they know it was contaminated? And did they sell it anyway? That question cost them $10 billion in settlements and triggered one of the most controversial bankruptcy maneuvers in American corporate history. This isn't a story about baby powder. It's about what happens when a company decides the cost of honesty is higher than the cost of silence. They were wrong. Johnson & Johnson was founded in 1886 in New Brunswick, New Jersey. Three brothers, Robert Wood Johnson I, James Wood Johnson, and Edward Mead Johnson, started a company to produce sterile surgical supplies. This was not a trivial moment in medical history. In the 1880s, surgery was frequently a death sentence, not from the operation itself, but from infection afterward. The British surgeon Joseph Lister had recently introduced the concept of antiseptic technique, using carbolic acid to sterilize wounds and instruments, and the Johnson brothers believed they could industrialize that idea, mass-produce sterile dressings, sutures, and surgical supplies that hospitals could trust. They were right. The timing was perfect. The company grew fast. By 1894, Johnson & Johnson had introduced its first consumer product, a maternity kit designed to reduce infection rates in childbirth. By 1921, it had introduced the Band-Aid. By 1932, Robert Wood Johnson II had taken over and was building the company into a diversified healthcare giant. By the time World War II ended, Johnson & Johnson was supplying the American military with medical products and was embedded in the infrastructure of American healthcare in a way no competitor could match. And in 1894, the same year as the maternity kit, Johnson & Johnson began selling Johnson's baby powder, a simple product, talc, lightly fragranced, marketed for use on infants to prevent diaper rash and skin irritation. It became one of the most recognizable products in American consumer history. The white bottle, the soft yellow label, the smell that an entire generation associated with safety, with childhood, with their mother's hands. And that smell would eventually become the smell of the largest mass tort litigation in American legal history. Talc is a mineral. It's the softest mineral on Earth, number one on the Mohs hardness scale, the system geologists use to rank how easily a mineral is scratched. It's composed of magnesium, silicon, and oxygen. It has a natural slippery quality that makes it useful in cosmetics, pharmaceuticals, paper manufacturing, and plastics. It is also frequently found in the earth in close proximity to asbestos. Asbestos, that's the term for a group of naturally occurring silicate minerals with a fibrous structure that, when inhaled, can cause mesothelioma, a rare and almost universally fatal cancer of the lining of the lungs, stomach, or heart. The link between asbestos exposure and mesothelioma has been established in medical literature since the 1930s. By the 1960s and 1970s, it was not a hypothesis. It was settled science. The problem with talc mining is geological. Asbestos and talc form in similar geological conditions. They are often found in the same rock formations, which means that talc extracted from the earth can contain asbestos fibers. And without rigorous testing and processing, those fibers can end up in the finished product. Johnson & Johnson knew this. They had known it for decades. The internal documents that would eventually detonate the company's reputation began emerging in litigation in the early 2000s. But the story they told stretched back to the 1950s and 1960s. Internal memos showed that as early as 1957, when scientists working with Johnson & Johnson's talc supply had detected fibrous material in the raw talc, material consistent with asbestos. By the late 1960s and early 1970s, as the scientific community was establishing the deadly nature of asbestos exposure, internal testing at Johnson & Johnson was producing results that raised questions about contamination in their talc supply. In 1976, the FDA began investigating talc-based cosmetic products for asbestos contamination, following rising public awareness of asbestos dangers in occupational settings. Johnson & Johnson participated in the regulatory discussions. They supplied testing data. The agency ultimately did not mandate removal of talc from cosmetics, in part because testing methodologies at the time were inconsistent and detection limits were relatively crude. Said Johnson & Johnson took the absence of regulatory action as cover, not as an invitation to improve, as cover. Through the 1980s and 1990s, the company continued selling baby powder and its shower-to-shower talc product, a product marketed specifically for adult use, applied directly to the body daily, all while internal testing was periodically detecting trace amounts of asbestos in their raw material supply. The documents showed something more troubling than negligence. They showed awareness. They showed scientists raising concerns internally. They showed executives discussing how to respond to regulatory inquiries in ways that minimized disclosure. They showed a company that understood the risk and made a calculation that managing the information was cheaper than addressing the problem. Just that calculation was wrong by approximately $10 billion and counting. The modern legal catastrophe began slowly, then all at once. In 2002, a woman named Dean Berg filed one of the first lawsuits directly linking Johnson & Johnson's baby powder to ovarian cancer. The claim, which would eventually become the central allegation in tens of thousands of cases, was that talc particles applied to the perineal area could migrate into the reproductive system and cause ovarian cancer. The epidemiological evidence on this specific claim was genuinely contested. Unlike the asbestos mesothelioma link, which was well established, the talc ovarian cancer connection was the subject of ongoing scientific debate. Some studies showed elevated risk, others did not. And the International Agency for Research on Cancer classified perineal use of talc as possibly carcinogenic, a category that represents scientific uncertainty, not scientific consensus. Johnson & Johnson's legal team used this ambiguity effectively for years. They won many of the early cases. The scientific uncertainty gave them room to operate. But in 2013, a Missouri jury awarded $72 million to the family of Jacqueline Fox, a woman who had used Johnson's baby powder daily for 35 years and died of ovarian cancer. It was the first major verdict against the company. It would not be the last. Between 2016 and 2018, Missouri juries handed down verdicts totaling over $4.7 billion in a single consolidated trial involving 22 plaintiffs, $4.7 billion from one state in one trial for a product that was still on store shelves. Johnson & Johnson appealed. They won some reductions. They lost many more. The cases kept multiplying. By 2019, the company faced over 15,000 pending lawsuits related to talc, asbestos contamination claims, and ovarian cancer claims combined. By 2021, that number had grown to over 40,000. 40,000 lawsuits, all connected to one product, one mineral, one decision made somewhere in the 1950s to keep selling something they weren't entirely sure was safe. And then, on December 14th, 2018, the floor fell out. Reuters published an investigation. The headline was measured. The content was nuclear. And the Reuters reporting revealed that Johnson & Johnson's internal documents the company had fought in court to keep confidential, showed that the company had known for decades that its talc supply could be contaminated with asbestos. Not suspected, known, internal memos, testing results, communications between scientists and executives discussing how to respond to regulatory inquiries, a paper trail stretching from the 1950s to the early 2000s. The company denied the Reuters findings immediately and completely. They called the reporting false and inflammatory. They said their products had always been safe. They pointed to decades of regulatory approvals and independent testing. The stock market was less reassured. Johnson & Johnson's stock dropped 10% in a single day on December 14th, 2018, a $40 billion loss in market capitalization in one trading session. Read that again. $40 billion gone in one day because of baby powder. The reputational damage was harder to quantify but easier to see. Mothers who had dusted their babies with Johnson's powder for years were reading the Reuters report at their kitchen tables and feeling something that no advertising campaign could undo. Not anger, fear. The specific, cold, retrospective fear of someone who trusted something completely and is now being told that the trust may have been misplaced. In May 2020, Johnson & Johnson announced it was discontinuing the sale of Johnson's baby powder in the United States and Canada. The official reason was shifting consumer habits and a cloud of misinformation around the safety of the product. Not because it was unsafe, because of misinformation. The framing was telling. Even in the act of pulling the product from North American shelves, the company refused to acknowledge that the product had ever posed a risk. They were exiting the market while maintaining that the market's concerns were irrational. In 2023, they discontinued the talc-based baby powder globally, replacing it with a cornstarch-based formula. The talc era was over, but the legal era was very much not. Now enter the strategy that made corporate lawyers famous and bankruptcy professors write textbooks. The Texas two-step. Here's how it works. In certain U.S. states, Texas being the primary example, a company can execute what's called a divisional merger. That means it can split itself into two separate legal entities. One entity keeps the profitable assets, the brands, the products, the revenue streams. The other entity absorbs all the liabilities, or in this case, the tens of thousands of talc lawsuits. The liability entity then immediately files for bankruptcy. Bankruptcy triggers an automatic stay, a legal pause, on all pending litigation. The bankruptcy court takes control of resolving the claims, typically through a settlement trust funded by the parent company. The result? The profitable company continues operating normally, protected from the lawsuits. The liability company, which has no real assets, no employees, no ongoing business, goes through bankruptcy and settles claims at a negotiated fraction of what jury trials would have awarded. Johnson & Johnson executed this maneuver in 2021. They created a subsidiary called LTL Management, officially incorporated in Texas, then immediately moved to New Jersey, transferred all talc liability into it, and had LTL file for bankruptcy within 2 days. 2 days. From creation to bankruptcy filing. The plaintiff's lawyers called it a fraud on the court, a manipulation of the bankruptcy system designed to strip cancer patients of their constitutional right to a jury trial. And the legal term they used was bad faith filing, the argument that a company with billions in assets and no genuine financial distress was using the bankruptcy code not as a refuge of last resort, but as a litigation management tool. The Third Circuit Court of Appeals agreed. In January 2023, they dismissed LTL's bankruptcy filing, ruling that LTL did not meet the financial distress threshold required for a legitimate bankruptcy case. Johnson & Johnson tried again. They filed a second LTL bankruptcy in 2023. The courts dismissed it again. In 2024, they attempted a third approach, proposing a $6.475 billion settlement to resolve all current and future talc claims through a pre-packaged bankruptcy plan. The plan required 75% of current claimants to approve it. The vote did not reach 75%. The plan failed. The litigation continued. Let's pause and understand what $10 billion actually means in the context of Johnson & Johnson's finances. Because context matters here. Johnson & Johnson generates approximately $85 billion in annual revenue. Their pharmaceutical division alone, products like Stelara for psoriasis and Darzalex for multiple myeloma, generates margins that most companies would structure entire businesses to achieve. So $10 billion in talc liability, spread over several years, is not existential for Johnson & Johnson, the corporation. It is painful. It is embarrassing. It is a massive number that represents genuine suffering, real people with real cancers, real mesothelioma diagnoses, real ovarian cancer deaths. But it is not bankruptcy, which is exactly why the bankruptcy maneuver was so legally controversial. You cannot use the bankruptcy code as a shield when you are not actually broken. What the talc litigation did that money cannot fully capture is something more corrosive than financial loss. It destroyed the architecture of trust that Johnson & Johnson had spent 135 years constructing. The Credo. Let's talk about the Credo. In 1943, Robert Wood Johnson II wrote a document called Our Credo. It was a statement of corporate value, and it was extraordinary for its time. It established a hierarchy of responsibilities for Johnson & Johnson that explicitly put customers first, before employees, before communities, before shareholders. The first line of the Credo reads, "We believe our first responsibility is to the patients, doctors, and nurses, to mothers and fathers and all others who use our products and services." The Credo was not marketing copy. It was, or was supposed to be, operational philosophy, the guiding principle behind every product decision, every safety review, every communication with regulators. For decades, the credo was cited as the reason Johnson & Johnson handled the 1982 Tylenol crisis so effectively. When 7 people in Chicago died after someone tampered with Tylenol capsules laced with cyanide, Johnson & Johnson immediately recalled 31 million bottles of Tylenol from store shelves nationwide before the FBI asked, before the FDA required it, before the scale of the problem was fully understood. The cost was approximately $100 million. The decision was made in 24 hours. The credo said customers first. The company acted accordingly. The Tylenol response became the gold standard of corporate crisis management. It was taught in business school. It was cited by executives for decades as proof that Johnson & Johnson's values were not performative. They were structural. And then came Talc and the internal memos from the 1950s and the Texas two-step and the argument that cancer patients were spreading misinformation. The credo says first responsibility is to patients. The Talc litigation suggests the first responsibility was to the quarterly earnings call. The distance between those two things, between what the credo said and what the documents showed, is the precise distance between what Johnson & Johnson was and what it became in the public imagination. Not a healthcare company, a liability management operation with good packaging. Financial markets understood the shift before the public did. Johnson & Johnson's stock traded above $180 per share in early 2018 before the Reuters report. By the end of 2023, adjusting for the spin-off of its consumer health division into a separate company called Kenvue, that's the business reorganization where J&J separated its consumer brands from its pharmaceutical and medical device operation. The combined value had declined significantly from pre-crisis projections. The Kenvue spin-off itself was instructive. In May 2023, Johnson & Johnson spun off all of its consumer health brands, including what remained of the baby powder business, the Band-Aid business, the Neutrogena business, the Listerine business, into a publicly traded company called Kenvue. Johnson & Johnson retained its pharmaceutical and medical device division. The official explanation was strategic focus. Pharmaceutical and medical device businesses trade at higher valuation multiples than consumer health businesses. Separating them would unlock shareholder value. The unofficial reading, which analysts discussed openly, was different. Johnson & Johnson was separating its profitable future from its litigious past. The consumer brands, the ones connected to Talc, the ones that carried the emotional weight of the brand's reputation, went into Kenvue. The high-margin pharmaceutical engine stayed with J&J. It was not the Texas two-step, but it rhymed with. The consumer damage is the number that doesn't appear in earnings reports, but shows up everywhere else. In 2023, a Morning Consult survey found that Johnson & Johnson's brand trust scores among American consumers had declined by over 30 percentage points from their pre-2018 level. Among women under 45, the core demographic for baby and personal care products, the decline was even steeper. Competitors moved quickly into the space that Johnson & Johnson's Talc crisis created. Burt's Bees expanded its baby product line. California Baby gained distribution in major retailers. Aveeno, ironically an Aveeno brand owned partly by Johnson & Johnson's former consumer division, shifted its marketing toward oat-based formulation that carried no talc association. The shelf space that baby powder had occupied for over a century was quietly redistributed to competitors who had never made the compromises Johnson & Johnson had. Known the mothers who had bought baby powder because their mothers had bought baby powder, the generational loyalty that had sustained the brand through recessions, through competitor launches, through every challenge for 100 years, that loyalty was over. You cannot market your way past fear. You cannot advertise your way past a document that says your scientists knew and your executives decided not to tell anyone. Johnson & Johnson is not going away. Let's be precise about that. Their pharmaceutical division, driven by immunology drugs, oncology treatments, and medical devices, generates revenue and margin that most companies could not achieve in a lifetime. Stelara alone generated over $10 billion in revenue in its peak year. The company remains one of the largest healthcare corporations on earth. Music. But the Johnson & Johnson that existed before December 14, 2018, the company that occupied a specific emotional position in American life, that stood for something beyond its product, that parents trusted without question, that company's gone. It can be argued about in courts. It can be restructured into Kenvue and pharmaceutical divisions and medical device subsidiaries, but it cannot be rebuilt. Trust, once broken at this scale, does not recover. It transfers. It goes to the competitor who was more on it, to the brand that never asked you to take it on faith, to the product with the simpler ingredient list and the cleaner history. The white bottle is gone from most store shelves, the soft yellow label, the smell that a generation associated with their children's skin, gone. Not because talc was definitive, conclusively, scientifically proven to be dangerous in every application for every user. The science remains genuinely contested in some areas, but because Johnson & Johnson had a choice, the same choice they made in 1982 with Tylenol, and this time they chose different. They chose to manage the information, to dispute the documents, to file subsidiaries into bankruptcy, to call sick people's lawyers ambulance chasers, and their claims misinformation. In 1982, the credo won. In 2018, the legal department won. And in the distance between those two outcomes, in that specific gap between what what the company said it stood for and what the documents showed it actually did. The most trusted brand in American consumer history quietly, expensively, and permanently lost the only thing that had ever made it special. Not the products, not the patents, not the distribution network or the hospital relationships, or the 135 years of market presence, the trust. The diapers are still sold, the Band-Aids are still on the shelf, but the belief that Johnson & Johnson would never put something dangerous in a bottle and hand it to a mother for her baby, that belief is gone. And in the consumer goods business, belief is the only product that ever really matters.